care delivery. Before we dive into specific roles and responsibilities, I want you to think about how the nursing profession has evolved and how it continues to adapt to the needs of patients and communities. Nursing is not just about providing care, it's about understanding where we fit in the broader healthcare system, which includes hospitals, clinics, long-term care facilities, community health, and home health services. Every nurse, whether practical, registered, or advanced practice, plays a vital role in maintaining quality, safety, and accessibility within this system. We'll discuss the different levels of care, from primary and secondary to tertiary care, and how nurses collaborate with other members of the healthcare team to meet patient needs across these levels. By the end of this chapter, you should have a solid understanding of how the healthcare system is organized, how policies and funding affect care delivery, and how LPNs contribute to quality patient outcomes within that system. Remember, understanding the structure of the healthcare system helps you think critically about your role as a nurse, how your care decisions affect not just one patient, but the overall quality and efficiency of the system as a whole. Let's take a look at how nursing began to take shape in England and Europe. In the early days, before modern hospitals existed, caring for the sick was not considered a medical profession. It was a spiritual duty. With the spread of Christianity, care for the ill became the responsibility of religious orders, such as monks and nuns. Their mission was to show compassion and serve others as an act of faith. During this period, nurses worked under the direction of priest-physicians, who were often the most educated members of society. These priest-physicians guided both spiritual and physical healing, blending religion with medicine. A key figure mentioned in early nursing history is Phoebe, who was introduced by St. Paul in the Christian Bible. Phoebe was known as a deaconess, which is similar to a practical nurse today. She provided hands-on care and spiritual support, setting one of the earliest examples of organized nursing in Rome. By the time of the Crusades, between 1100 and 1200 AD, nursing began to be recognized as a true vocation. Religious groups, such as the Knights Hospitaller, cared for soldiers and the sick during wartime. This era helped define nursing as both a calling and a service profession, rooted in compassion, duty, and faith. So as you can see, the foundation of nursing wasn't just about medicine. It was about service, spirituality, and caring for others, long before hospitals and health systems as we know them today even existed. Florence Nightingale, often called the founder of modern nursing. In the mid-1800s, Florence Nightingale felt what she described as a calling from God to care for the sick and suffering. This was a bold decision for her time because women of her social class were not expected to work, especially not in nursing, which was considered a low-status occupation. She studied in Germany with a Protestant order of women who devoted their lives to caring for the ill. There she learned about sanitation, organization, and compassionate care, principles that became the foundation of her life's work. When she later went to care for soldiers during the Crimean War, she found hospitals in terrible condition, dirty, overcrowded, and poorly ventilated. Florence cleaned up the wards, improved ventilation, sanitation, and nutrition, and insisted on cleanliness and hand washing. As a result, the death rate dropped dramatically. Florence was also a pioneer in using data and statistics to prove that her methods worked. She carefully recorded outcomes and used charts to convince government officials that better sanitation saved lives, something we still value today in evidence-based practice. After the war, she opened the first Nightingale training school for nurses at St. Thomas Hospital in England. Her graduates helped spread her standards of education, hygiene, and professionalism throughout the world. Florence Nightingale's legacy lives on in modern nursing. Every time we emphasize cleanliness, documentation, and patient-centered care, we're building on the foundation she laid more than 150 years ago. Florence Nightingale didn't just reform hospitals, she also revolutionized nursing education. When she developed her curriculum, she based it on key beliefs that still shape nursing practice today. First, she believed that nutrition is an important part of nursing care. She understood that good food helps the body heal faster and maintain strength. Even today, we monitor patients' diets and encourage balanced meals as part of their recovery. Second, she taught that fresh, clean air is essential for the sick. Remember, this was before antibiotics. Nightingale saw how proper ventilation reduced infection and promoted healing. Her attention to environment laid the foundation for what we now call environmental health and infection control. She also believed that patients need meaningful activity, such as occupational or recreational therapy, to prevent boredom, depression, and decline. Keeping the mind and body active was just as important as treating disease. Florence emphasized that nurses should identify and meet personal needs, including emotional support. She saw nursing as a caring, holistic profession, focused not just on the illness but on the whole person. She also believed that nursing should focus on both health and illness, not just the treatment of disease. This means nurses should help prevent illness and promote wellness. Another key belief was that nursing is distinct from medicine. Nurses are not assistants to doctors. They have their own body of knowledge and professional responsibilities. Nursing education, she said, should be taught by nurses themselves. Finally, Florence stressed that learning never ends. She promoted continuing education for nurses, encouraging us to stay current with science, research, and best practices, something we still value in professional nursing today. So, when you think about Nightingale's legacy, remember this. Many of the core principles we follow in nursing, nutrition, cleanliness, holistic care, professionalism, and lifelong learning, all began with her vision. Now let's look at how nursing developed in North America, especially the roots of practical nursing, which is the foundation of your own nursing education today. One of the first organized programs was the Ballard School, started by the New York Young Women's Christian Association, or YWCA, in 1892. This program was designed for women who wanted to learn how to care for the sick, especially in the home. It was a 3-month course, short compared to today's standards, but it provided essential skills for caring for infants, children, and older adults. Students learned basic hygiene, nutrition, home care, and comfort measures. At that time, hospitals were limited and expensive, so most care took place at home. The Ballard School prepared women to meet those needs in their communities. You can think of it as one of the earliest examples of home health nursing and the first formal training for what we now call LPNs or LVNs. Another early program was the Household Nursing School in Boston, which was later renamed the Hepard-Gill School of Practical Nursing. Like the Ballard School, it focused on hands-on training in home care, emphasizing the importance of compassion, cleanliness, and practical skills. These early schools paved the way for today's practical nursing programs. They helped transform nursing from informal caregiving into a respected profession grounded in education, ethics, and skill. So as you study to become an LPN, remember, you're part of a long history that began with these pioneering programs and the strong women who believed nursing was both a calling and a science. What education looked like for nursing students during the late 1800s and early 1900s. Back then, nursing education was very different from what we know today. Students didn't have formal classrooms, instructors, or structured coursework. Instead, they learned by doing and often did so under very harsh conditions. Students staffed the hospitals and worked long hours, sometimes 12 to 16 hours a day, without pay. They were the main source of labor for hospitals, providing care, cleaning, and assisting with procedures. Their learning came directly from experience, not from lectures or textbooks. There were no formal classes or curriculum, meaning that what a student learned depended on the hospital's needs and the physician's willingness to teach. Education was achieved through work, not through theory or organized instruction. Most of the teaching was done at the patient's bedside, and it was usually provided by physicians, not nurses. This meant that nursing students were taught primarily from a medical perspective, focusing on doctors' orders rather than nursing principles. While this model helped hospitals operate, it also limited nursing as a profession. There was little consistency or opportunity for growth, and students often left training exhausted and underprepared for independent practice. These conditions eventually led to major reforms in nursing education. Over time, nursing evolved from an apprenticeship system, learning through labor, to a professional education system with structured curricula, licensed instructors, and defined standards of care. This transformation is what allows you today, as nursing students, to learn in a balanced environment, combining clinical experience with theory, ethics, and patient-centered care. Nursing is both an art and a science. The science comes from our knowledge, our understanding of anatomy, physiology, pharmacology, and evidence-based practice. The art comes from how we use that knowledge, with compassion, communication, and care. As practical nurses, you perform several key roles that blend both science and art. Let's look at each one. First, you are a caregiver. This is the core of what nurses do, providing direct care and implementing interventions that improve, maintain, or restore health. Whether you're giving a medication, changing a dressing, or simply holding a patient's hand, you are supporting healing. Second, you serve as an educator. Nurses teach patients and families every day, explaining medications, promoting healthy habits, and helping prevent illness. Teaching doesn't always happen in a classroom. It often happens in small, meaningful moments at the bedside or during discharge planning. Third, you are a collaborator. You work closely with RNs, physicians, therapists, and other members of the healthcare team to ensure continuity of care. Collaboration means communicating effectively and understanding everyone's role so that patient care stays coordinated and safe. Next, you act as a patient advocate. This means standing up for your patient's rights, preferences, and safety. You're often the one who notices changes first, or recognizes when a patient's voice needs to be heard. Advocacy is a key ethical duty for every nurse. Finally, you take on the role of manager. As an LPN, you may assign or delegate minor tasks to nurse assistants or other team members while ensuring that care remains safe and appropriate. This requires leadership, judgment, and accountability. Together, these 5 roles, caregiver, educator, collaborator, advocate, and manager, represent the balance between nursing's scientific foundation and its human touch. Every shift you work, you'll use both to deliver quality, compassionate care. Evidence-based nursing means that our decisions and actions as nurses are not based on habits, opinions, or routines, but instead on the best available research evidence. In other words, we use science and data to guide how we care for patients. When we say using the best research evidence, because we're talking about reviewing studies, clinical guidelines, and proven outcomes to decide what works best in specific situations. This ensures that the care we provide is safe, effective, and up to date. Evidence-based practice helps us identify what we call best practices. Best practices are techniques or interventions that have been shown through research to produce the best patient outcomes. For example, using alcohol-based hand sanitizer before and after every patient contact is a best practice supported by strong evidence for infection control. As practical nurses, you will apply evidence-based practice every day by following your facility's policies and procedures, reviewing current standards of care, and being open to new research that improves patient safety and outcomes. Remember, the goal of evidence-based nursing is simple but powerful: to make sure that every nursing decision we make is based on facts, not tradition, and that everything we do helps patients heal faster, safer, and better. Now let's talk about what guides current nursing practice, the Nurse Practice Act. Every U.S. state and Canadian province has its own Nurse Practice Act, which is a law that defines what nurses are legally allowed to do. These acts are not optional. They are state laws that every nurse must follow to practice safely and legally. The Nurse Practice Act serves 3 main purposes. First, it regulates the practice of nursing. This means it sets clear rules about what tasks nurses can perform, what requires supervision, and what is outside the nurse's scope of practice. Second, it's designed to protect the public. That's one of the most important points. The Nurse Practice Act ensures that only qualified, licensed individuals can provide nursing care. It prevents untrained or unlicensed people from practicing nursing, which keeps patients safe. Third, it defines the legal scope of practice for each level of nurse, such as the LPN, RN, and advanced practice nurse. This includes everything from medication administration to patient teaching and delegation. For you as future LPNs, it's critical to understand your state's Nurse Practice Act. It tells you exactly what you can and cannot do. For example, certain procedures or IV therapies might require additional certification or RN supervision depending on your state. When you think about it, the Nurse Practice Act is both a protection and a guide. It protects your license, supports your professionalism, and ensures that the care you give is safe, ethical, and within your legal authority. So remember, when in doubt, check your state's Nurse Practice Act. It's your legal foundation for safe nursing practice. The nursing process is an organized, deliberate, and systematic way to deliver nursing care. It helps us think critically and make decisions that are logical, safe, and centered on the patient. Instead of reacting to problems as they arise, we use this process to plan and evaluate our care from start to finish. It's made up of 5 steps: assessment, diagnosis, planning, implementation, and evaluation. You'll learn each of these steps in detail throughout your program, but the key idea is that this process gives nurses a consistent way to provide care that's individualized and evidence-based. The nursing process provides a structured way to implement caregiving. It ensures that what we do for patients has a clear purpose, goal, and outcome. Whether you're assisting with wound care, giving medications, or teaching a patient about diet, each action ties back to a plan that was created using the nursing process. It also combines the science and the art of nursing. The science comes from our knowledge, skills, and clinical reasoning, while the art comes from how we communicate, comfort, and care for each patient with empathy. Most importantly, the nursing process helps us focus on the patient as an individual. Every patient is different needs, backgrounds, beliefs, and goals. The nursing process reminds us that our care must always be personalized and patient-centered, not just task-oriented. So when you hear the term nursing process, just think of it as the foundation of everything we do. It's our roadmap for providing safe, effective, and compassionate care. Practical nursing programs are designed to prepare students to provide direct patient care under the supervision of a registered nurse, physician, or dentist. That means as an LPN, you'll work closely with the rest of the healthcare team, performing hands-on skills and observing for changes in your patient's condition. The focus of practical nursing education is to help you become competent in providing safe, effective, and compassionate care in real-world settings. You'll learn not just the how, but also the why behind nursing interventions, linking what you do to the science of nursing and patient outcomes. These programs are offered in a variety of settings: vocational schools, hospitals, proprietary schools, and community colleges, just like where you're studying now. Most programs are about 12 to 18 months long and combine classroom instruction, lab practice, and clinical experience. After graduation, you'll be eligible to take the NCLEX PN, which is the licensing exam that allows you to officially practice as a licensed practical nurse. Practical nursing is often the first step in a nursing career pathway. Many LPNs later continue their education to become RNs or even advanced practice nurses, but the foundation of hands-on, bedside care you gain as an LPN will always be at the heart of nursing. So remember, this pathway may start with practical nursing, but it opens the door to a lifelong career of learning, growth, and patient advocacy. Let's continue exploring the different nursing education pathways, starting with registered nursing and moving up to advanced practice nursing. To become a registered nurse, or RN, students must complete one of 3 educational programs. Each of these qualifies graduates to take the NCLEX RN examination, which is the licensing exam for registered nurses. The first option is the hospital-based diploma program, which was once the most common path. These programs are often connected directly to hospitals and focus heavily on clinical experience. The second option is the 2-year associate degree in nursing, which is offered at community colleges. This route is popular because it provides a strong foundation in nursing skills and knowledge, while being affordable and accessible. The third pathway is the 4-year baccalaureate degree in nursing, or BSN, earned at a college or university. BSN programs include leadership, research, and community health courses, preparing nurses for broader roles in management or education. Registered nurses may provide bedside care, coordinate care in the community, or supervise others, including LPNs and nursing assistants, in managing care for multiple patients. They often take on leadership responsibilities within the healthcare team. Now, for those who want to continue their education beyond the RN level, there are opportunities in advanced practice nursing. These include graduate programs for master's and doctorate degrees, where nurses prepare to become specialists in areas like clinical practice, education, research, or administration. Many of these programs include nurse practitioner pathways, where RNs receive advanced training to diagnose, prescribe, and manage patient care within a specialty, such as family practice, pediatrics, or geriatrics. So, as you can see, nursing offers multiple entry points and opportunities for growth. Your practical nursing education is just the beginning. You can build on it over time and reach any level of nursing you aspire to, from bedside care to advanced clinical leadership. Now let's talk about how nursing care is actually delivered in different settings. Over time, several models have been developed to organize how nurses provide care to patients. The three most common systems are functional nursing, team nursing, and total patient care. Let's start with functional nursing care. This was one of the earliest systems used in hospitals and was actually the first care delivery system for practical nurses. In this model, each nurse is responsible for specific tasks or functions. For example, one nurse might pass all medications, another might perform treatments, and another might handle documentation or hygiene care. In this system, practical nurses performed assigned tasks, such as administering medications or providing wound care, while registered nurses or physicians oversaw the patient's overall plan of care. It was efficient, especially when hospitals had large numbers of patients, but it could also make care feel fragmented, because no single nurse was responsible for the whole patient. Next, we have team nursing. This approach developed to solve that problem. In team nursing, a registered nurse acts as the team leader and coordinates care for a group of patients. The RN assigns work to other members of the team, such as practical nurses and nursing assistants, based on their skills and scope of practice. This system emphasizes collaboration and communication. Each member contributes to patient care, and everyone works together toward the same goal. As a practical nurse, you'll often be an important part of the team, helping carry out care plans, observing changes, and reporting findings to the RN. Finally, there's total patient care. In this model, one nurse provides all aspects of care for the patient during their shift. That includes medication administration, treatments, hygiene, and emotional support. The goal is to provide less fragmented, more holistic care, since one nurse is fully responsible for each patient's needs during that time. Each of these systems has advantages depending on the setting. Functional care focuses on efficiency. Team nursing emphasizes collaboration, and total patient care prioritizes individualized attention. As an LPN, you'll likely experience all three models in different clinical environments, and understanding them helps you adapt and provide the best care possible. Primary nursing was developed to provide greater continuity and accountability in patient care. In this model, one nurse plans and directs care for a patient over a full 24-hour period. This means that the same nurse takes responsibility for assessing, planning, and evaluating that patient's care, even though other nurses may help carry out the plan during different shifts. The key goal of primary nursing is to eliminate the fragmentation of care that can occur when different nurses take care of the same patient with different approaches or communication styles. Instead, the primary nurse builds a consistent, trusting relationship with the patient and family. The patient always knows who their go-to nurse is, which improves satisfaction and outcomes. Over time, this model has been modified to meet the demands of today's healthcare environment. Many facilities now use versions of primary nursing that include cross-trained personnel, such as nursing assistants, practical nurses, or patient care technicians. These team members help with routine duties while the primary nurse maintains responsibility for care coordination and decision-making. As an LPN, you may work alongside a primary nurse or carry out assigned portions of the care plan. Understanding this model helps you see how each role supports the continuity, quality, and personalization of nursing care. The main takeaway is that primary nursing strengthens the nurse-patient relationship and ensures that care remains coordinated, consistent, and centered on the patient's individual needs. This model was created in response to the growing need for nurses to reconnect with the heart of patient care: relationships. Relationship-based care focuses on three key relationships that form the foundation for excellent nursing practice. The first relationship is the nurse's relationship with the patient and family. This emphasizes seeing each patient as a unique individual rather than just a diagnosis or task list. It means taking time to listen, communicate clearly, and understand the patient's goals, preferences, and fears. The stronger this relationship, the better the trust, satisfaction, and outcomes. The second relationship is the caregiver's relationship with self. This is often the most overlooked, but one of the most important. To care effectively for others, nurses must also care for themselves, physically, mentally, and emotionally. That includes practicing self-reflection, managing stress, maintaining boundaries, and committing to ongoing learning. A healthy caregiver provides safer and more compassionate care. The third relationship is the relationship among colleagues. Nursing doesn't happen in isolation. It's a team effort. Mutual respect, open communication, and collaboration are what create a positive work environment. When nurses and other healthcare professionals support one another, patient care improves and staff satisfaction increases. So, relationship-based care brings nursing back to its roots. It reminds us that while technology and systems are important, it's the human connection that defines the art of nursing. It blends professionalism with compassion and helps ensure that care remains personal, holistic, and centered on relationships, with patients, with ourselves, and with one another. Now let's look at the many practice settings where nurses, especially LPNs, provide care. One of the great things about nursing is the variety of work environments you can choose from, each one offering different types of patients, responsibilities, and learning opportunities. We'll start with hospitals, which are one of the most common settings. Hospitals provide restorative care to patients who are ill, injured, or recovering from surgery. As an LPN, you may work on medical surgical units, long-term acute care, or specialty areas under the supervision of an RN. Your role focuses on direct patient care, monitoring vital signs, administering medications, and assisting with treatments to help patients recover. Next, we have subacute and extended care facilities. These include skilled nursing facilities and rehabilitation centers where patients receive intermediate or long-term care. Some patients may need rehabilitation after a stroke or injury, while others require custodial care because they can't live independently. In these settings, LPNs often play a central role in maintaining continuity of care and building strong relationships with residents over time. Assisted living facilities provide a more home-like environment for residents who need some assistance but still want independence. Here, nurses often oversee medication management, health monitoring, and coordinate care, while support staff handle housekeeping and meal preparation. Medical offices are another setting where LPNs work. These are outpatient environments where ambulatory patients come for preventive care, routine exams, or treatment of illness and injury. LPNs may take patient histories, assist with exams, give injections, and provide education, all while supporting the provider. School nursing is another rewarding option. In this setting, the nurse provides triage, first aid, medication administration, and health teaching for students. School nurses also help manage chronic conditions like asthma or diabetes, ensuring students can learn safely and stay healthy. Finally, surgical centers, also known as ambulatory surgery centers, provide same-day surgical care for healthier individuals who don't require overnight stays. As an LPN, you might assist in preoperative preparation, postoperative monitoring, and patient teaching before discharge. Each of these practice settings offers a different rhythm and focus, but the core of nursing remains the same, delivering safe, compassionate, patient-centered care. Whether in a hospital or community clinic, LPNs are essential members of the healthcare team. Let's continue exploring the many practice settings where practical nurses can work. These environments expand beyond hospitals and long-term care to include specialized and community-based roles that serve patients in a wide range of situations. First, we have ambulatory clinics. These are outpatient facilities where patients come for preventive care, minor treatments, or follow-up visits for ongoing conditions. As an LPN, you might assist with vital signs, vaccinations, wound care, or health teaching. The focus in this setting is on helping patients maintain health and prevent complications, rather than managing acute illness. Next, kidney dialysis centers are another key area. Here, patients with chronic kidney failure receive renal dialysis treatments several times a week to remove waste products from their blood. LPNs in dialysis centers often monitor patients during the procedure, manage access sites, and provide education on diet and fluid restrictions. It's a highly specialized setting that combines technical skill with compassionate care for patients managing lifelong conditions. Hospice and palliative home care focus on comfort and quality of life for patients who are terminally ill. Hospice care provides support for both patients and families, addressing physical, emotional, and spiritual needs. LPNs play a vital role in administering medications, managing symptoms, and offering reassurance to patients and loved ones during end-of-life care. Home health agencies provide nursing care directly in the patient's home. This setting allows nurses to see patients in their daily environments and help them remain as independent as possible. LPNs may perform wound care, medication administration, and patient teaching, often coordinating care with RNs, therapists, and physicians. Neighborhood emergency centers and urgent care clinics offer immediate treatment for minor emergencies like lacerations, infections, or sprains. The pace here is fast and varied, and LPNs assist with triage, procedures, and patient education. It's an excellent setting for developing strong assessment and multitasking skills. Finally, correctional facilities are another unique area of practice. Nurses in jails and prisons provide routine physical exams, medication administration, and medical treatments for incarcerated individuals. This role requires strong communication, safety awareness, and the ability to provide non-judgmental professional care. No matter the setting, hospital, home, or community, LPNs are essential members of the healthcare team. Each environment brings new challenges and opportunities, but the goal remains the same: to promote health, comfort, and dignity for every patient. Let's take a closer look at the levels of healthcare within today's healthcare system. Understanding these levels helps you see how patients move through the system and where nurses fit into the process of care. We begin with preventive care, which focuses on health promotion and disease prevention. The goal here is to keep people healthy and reduce the need for more expensive treatment later. Examples include immunizations, blood pressure screenings, smoking cessation programs, and wellness education. Preventive care empowers patients to take control of their own health. Next is primary care. This is often the patient's first point of contact with the healthcare system. It includes care from family doctors, nurse practitioners, or community clinics where patients receive routine checkups, early treatment for illness, and health education. The emphasis is on maintaining wellness and managing chronic conditions before they become severe. Secondary care comes into play when a patient needs specialized or acute care. This level includes hospital-based services such as emergency departments, diagnostic testing, or short-term medical and surgical care. Nurses in these settings provide complex monitoring, medication administration, and patient teaching to help stabilize health. Moving up, tertiary care is even more specialized and involves advanced medical technology and expertise. Examples include intensive care units, burn centers, oncology units, and cardiac surgery programs. This level of care focuses on treating serious or complicated illnesses that require highly trained professionals and state-of-the-art equipment. After acute treatment, patients may transition to restorative care. This level focuses on rehabilitation and recovery, helping patients regain function and independence after illness or surgery. Nurses in restorative care work closely with physical and occupational therapists, speech therapists, and social workers to support the patient's progress. Finally, we have continuing care, which provides long-term support for individuals with chronic illnesses, disabilities, or age-related needs. This includes nursing homes, assisted living, hospice, and home health care. LPNs are vital in continuing care settings, providing direct patient care, emotional support, and education to families. These 6 levels, preventive, primary, secondary, tertiary, restorative, and continuing care, form a coordinated system designed to meet patients' needs throughout their lifespan. As a nurse, understanding these levels helps you see how your role fits into the bigger picture of providing safe, effective, and patient-centered care. Let's talk about one of the most significant pieces of healthcare legislation in modern U.S. history, the Patient Protection and Affordable Care Act, also known as the ACA or Obamacare. The Affordable Care Act was signed into law in 2010, and its main goal was to make healthcare more accessible and affordable for all Americans. Before this law, millions of people were uninsured, and many could not afford coverage, especially if they had pre-existing medical conditions. One of the key features of the ACA was the requirement for most uninsured individuals to purchase health insurance, either through their employer, a government program, or a state marketplace. If they did not obtain coverage, they were required to pay a penalty on their income taxes. This was designed to encourage participation and help stabilize the cost of insurance. Another major change was that insurance companies could no longer deny coverage based on pre-existing conditions. This was especially important for patients with chronic illnesses such as diabetes, asthma, or cancer who previously struggled to find affordable insurance. The law also included a provision allowing young adults to remain on their parents' insurance plans until age 26. This has helped millions of college students and young professionals maintain health coverage during early adulthood. As a result of these changes, the national uninsured rate dropped significantly, from about 16% down to 3% in the years following implementation. This means millions more people gained access to preventive care, primary care, and early treatment, all of which improve health outcomes and reduce the long-term cost of care. For nurses, especially LPNs, the Affordable Care Act means working with a more diverse patient population and focusing more on preventive care, chronic disease management, and patient education. It also reinforces our role in promoting health literacy and helping patients navigate an increasingly complex healthcare system. In short, the ACA reshaped modern nursing practice by expanding access, reducing barriers to care, and emphasizing prevention and wellness, key values in today's patient-centered healthcare system. Answer 2. Rationale. Florence Nightingale believed in the value of education for nurses. She started the first school of nursing in England and encouraged nurses to continue their education after graduation. Answer for 4. Rationale. The training in the Nightingale schools was well organized with classes held separately from practical experience. The United States held no formal classes and no set curriculum. Instruction was accomplished at the bedside by a physician, and therefore came from a medical viewpoint. Answer 1. Rationale. Caregiving skills are interventions aimed at restoring and maintaining a person's health. Interventions are actions taken to improve, maintain, or restore health or prevent illness. Answer 3. Rationale. Practical nurses work in the areas where there is supervision by a registered nurse, physician, or dentist. Community nursing, school nursing, and public health nursing presently are primarily the arenas of the professional registered nurse. Let's start by defining what health really means. Health can mean different things to different people. For some, it simply means the absence of disease, not being sick, injured, or in pain. But for others, health is more than that. It means being able to function at their best level, physically, mentally, and socially, even when living with a chronic condition. For example, a person with diabetes who manages their blood sugar well, exercises, and feels in control of their daily life may still consider themselves healthy. That's because health isn't just about what's wrong with the body. It's about how well someone adapts and functions within their situation. According to Dorland's Medical Dictionary, health is defined as a state of optimal physical, mental, and social well-being. The popular idea that it is merely an absence of disease and infirmity is not complete. This definition reminds us that true health involves balance and harmony across all areas of life: body, mind, and spirit. It's a dynamic state that can change from day to day based on stress, environment, and lifestyle. As nurses, we need to see health as a continuum, not just healthy or sick, but a range between optimal wellness and severe illness. Our role is to help patients move toward the wellness side by promoting healing, teaching self-care, and supporting their emotional and social needs. So, when we talk about health, think beyond just lab results or vital signs. Health means helping each person achieve their best possible level of functioning, whatever that looks like for them. Now let's talk about the traditional views of health and illness, and how these different types of illness affect both patients and the care we provide. We'll start with chronic illness. A chronic illness develops slowly over time and often lasts throughout a person's life. Examples include diabetes, hypertension, or arthritis. These conditions don't usually go away but can often be managed with medication, lifestyle changes, and nursing support. The focus for patients with chronic illness is on management, adaptation, and maintaining quality of life. In contrast, acute illness develops suddenly and resolves in a short period of time. Think of illnesses like appendicitis, the flu, or a broken bone. The goal here is to treat the condition quickly, relieve symptoms, and help the patient return to their normal level of health. Next is terminal illness, which is an illness that cannot be cured and eventually results in death. Examples might include advanced cancer or end-stage heart disease. Nursing care for patients with terminal illnesses focuses on comfort, dignity, and emotional support for both the patient and their family. This is where palliative and hospice care become so important. We also have primary and secondary illnesses. A primary illness is the initial or main illness a person develops. For example, a person may be diagnosed with diabetes. A secondary illness occurs as a result of the primary illness or its treatment. For example, someone with diabetes may develop poor circulation, leading to a foot ulcer or infection. These secondary conditions often complicate recovery and require careful nursing assessment and intervention. Understanding these types of illnesses helps us tailor our care plans and anticipate patient needs. Whether an illness is short-term, long-term, or life-limiting, our role as nurses remains the same: to provide compassionate, evidence-based care that promotes comfort, adaptation, and the highest possible level of wellness. Now let's look at the stages of illness, the process that most people experience when they become sick and begin to recover. Understanding these stages helps nurses recognize what patients are going through physically and emotionally. The first is the transition stage. This is when a person first notices something doesn't feel right, maybe fatigue, a sore throat, or general discomfort. They may try to deny it at first, saying things like, "I'm fine, I just need rest." However, deep down, they begin to recognize that symptoms are present and that something is wrong. During this stage, people are often uncertain, anxious, or even irritated because they're not sure what's happening. As nurses, it's important to provide reassurance and encourage patients to seek appropriate care early on. Next is the acceptance stage. In this stage, the person acknowledges that they are ill and begins to take steps to get better. This may include scheduling a doctor's appointment, taking prescribed medications, or following treatment recommendations. The acceptance stage is when patients often start cooperating with care, and nurses play a key role in education and motivation here. We help patients understand their illness and the importance of following through with their treatment plan. Finally, we have the convalescence stage. This is the recovery phase, when the patient's symptoms begin to improve and they regain strength and function. During this stage, the focus shifts from treatment to restoration of health, and nurses support healing by promoting good nutrition, rest, activity as tolerated, and emotional support. Not everyone moves smoothly through these stages. Some patients may get stuck in denial or resist accepting care. Recognizing where a patient is in this process allows us to individualize nursing care and provide the right support at the right time. Now let's talk about what really determines a person's health. These are called the determinants of health, and they help us understand why some people are healthier than others. As nurses, recognizing these factors helps us plan care that's realistic and individualized. The first determinant is genetics. This includes the traits we inherit from our parents, such as eye color, height, and our risk for certain diseases. For example, someone with a family history of hypertension, diabetes, or breast cancer has a higher genetic risk. While we can't change a person's genes, we can focus on prevention and early detection through screenings and education. Next is behavior. This refers to the choices people make in their daily lives, like diet, exercise, sleep, smoking, alcohol use, or medication adherence. These are often called modifiable risk factors because behavior can change. Nurses play a huge role here by teaching and supporting lifestyle changes that promote long-term health. Environmental and physical influences include everything around a person that affects health: their home, workplace, neighborhood, air and water quality, and exposure to toxins or noise. Even things like lighting, crowding, or access to parks can influence wellness. Nurses must consider these factors when assessing a patient's health and safety. Medical care is another determinant. Having access to affordable, timely, and quality health care makes a big difference in preventing disease and managing illness. Many people face barriers like lack of insurance, transportation, or provider availability, all of which can lead to delayed diagnosis and poor outcomes. Finally, social factors play a powerful role. These include education, income, employment, housing, culture, and social support. For instance, someone with strong family and community connections tends to recover faster and cope better with stress or illness. When we put all of these determinants together, we can see that health isn't just about biology or medical treatment. It's shaped by a complex interaction between our genes, choices, environment, and social conditions. As nurses, understanding these helps us care for the whole person, not just the illness. When we say that nurses take a holistic approach, we mean that we care for the whole person, not just the illness or physical symptoms. This includes addressing the patient's biologic, psychological, sociologic, and spiritual needs. Holistic nursing recognizes that each of these aspects of health is interconnected. If one area is affected, it can influence the others. For example, a patient recovering from surgery may have physical pain, a biological issue, but that pain can also cause anxiety or fear, a psychological concern. It may limit their ability to socialize with family or participate in activities, and it could even lead them to question their faith or purpose, a spiritual concern. Holistic nursing focuses on all of these dimensions to promote true healing. In addition to medical treatments, nurses often incorporate complementary therapies to support wellness. These may include acupuncture, acupressure, biofeedback, meditation, and other relaxation techniques. These approaches help reduce stress, improve circulation, and promote balance in the body and mind. It's important to remember that holistic care does not replace traditional medicine, it enhances it. By integrating evidence-based complementary methods with conventional nursing interventions, we can help patients heal not just physically, but emotionally and spiritually as well. In practice, holistic nursing means listening deeply, showing empathy, creating a calm environment, and respecting the patient's beliefs and choices. It's about seeing the person behind the diagnosis, and that's what makes nursing such a powerful healing profession. Let's take a look at Maslow's theory of basic needs, one of the most important psychological theories that influences nursing care today. Abraham Maslow developed a hierarchy of human needs to explain what motivates human behavior. His theory tells us that people must meet their most basic physical and safety needs before they can focus on emotional or personal growth. In nursing, this theory helps us decide which patient needs to prioritize first, especially in urgent or complex situations. At the bottom of Maslow's hierarchy are the physiologic needs, the things every person must have to survive: food, water, air, rest, elimination, and temperature regulation. If these needs aren't met, nothing else matters. For example, a patient who is struggling to breathe or in severe pain cannot focus on learning about their diet or medication. Once physiologic needs are met, the next level is security and belonging. This includes feeling safe, both physically and emotionally. Patients need to trust that they are in a secure environment where their privacy, safety, and dignity are respected. Nurses promote this by maintaining a calm environment, explaining procedures, and building rapport with patients and families. The next level involves love and self-esteem. People need to feel loved, valued, and respected. Illness can threaten self-esteem, especially when a person loses independence or experiences changes in body image. Nurses can support this by encouraging independence, recognizing achievements, and providing emotional reassurance. At the top of the hierarchy is self-actualization, the highest level of human development. This is when a person reaches their full potential and feels fulfilled in life. In nursing, self-actualization might look like helping a patient set new goals after recovery or encouraging them to find meaning and purpose even in chronic illness. Maslow's theory reminds us that nursing care should always be prioritized according to human needs, from survival to self-fulfillment. Meeting basic needs first lays the foundation for emotional healing, growth, and overall wellness. Homeostasis refers to the body's ability to maintain internal stability even when external conditions change. Our biologic systems are constantly working to keep everything in balance, from body temperature and heart rate to blood pressure, fluid levels, and blood sugar. When something changes, the body automatically makes adjustments to restore that balance. Think about it this way. If a person goes out on a hot day, their body temperature begins to rise. In response, the hypothalamus, the body's temperature control center, signals the sweat glands to release sweat. As the sweat evaporates, it cools the body, bringing the temperature back to normal. That's homeostasis in action. Wellness is maintained or regained when the body can successfully keep this sense of balance, even as it faces challenges such as infection, injury, or emotional stress. When a person can adapt to those stressors, they remain in a state of health. But if the body can't adjust, for example, if someone becomes dehydrated, overwhelmed by stress, or develops disease, that balance is disrupted. Stress plays a major role in disturbing homeostasis. Whether the stress is physical, such as surgery or illness, or emotional, such as anxiety or grief, the body immediately begins to respond. It activates the fight or flight response, releasing hormones like adrenaline and cortisol to help the person cope. However, if stress continues over time, these changes can become harmful, raising blood pressure, weakening the immune system, and slowing healing. As nurses, our goal is to help patients restore and maintain homeostasis. We do this through careful assessment, early recognition of imbalance, and interventions that promote stability, such as fluid replacement, rest, emotional support, and patient education. Adaptation is the body's response to change. Whenever something happens that disturbs normal balance, like illness, temperature changes, emotional stress, or injury, the body immediately begins trying to restore stability. This process is essential for survival. The body's systems have self-regulatory mechanisms designed to maintain homeostasis. These mechanisms constantly monitor internal conditions, such as blood pressure, body temperature, and fluid levels. When something goes out of range, the body automatically triggers corrective actions. For example, if blood sugar rises after eating, the pancreas releases insulin to bring it back down. Or if blood pressure drops, the heart rate speeds up to keep blood flowing to vital organs. These adjustments are all examples of adaptation in action, the body working to maintain equilibrium. Adaptation requires a communication pathway between the brain and the body. The nervous system and endocrine system play major roles here. The brain, especially the hypothalamus, constantly sends and receives messages from organs, muscles, and glands. These signals tell the body what needs to change to stay in balance. In nursing, we see adaptation every day. Think of a patient recovering from surgery. Their body adapts to blood loss, pain, and anesthesia. Or someone under emotional stress, their heart rate increases, breathing quickens, and blood pressure rises as the body prepares to cope. When adaptation is successful, the person returns to homeostasis, that stable internal environment. But when adaptation fails or is overwhelmed, illness or injury can result. As nurses, our role is to support adaptation by managing stress, maintaining comfort, monitoring vital signs, and providing education that helps the patient's body and mind adjust to change. Next, let's talk about something that every nurse sees in practice, the body's response to stress, known as the General Adaptation Syndrome, or GAS. This concept was developed by Dr. Hans Selye and describes how the body reacts to long-term exposure to stress, whether that stress is physical, emotional, or environmental. The body doesn't distinguish between good stress and bad stress. It just responds the same way in an attempt to protect itself and restore balance. There are 3 stages of the General Adaptation Syndrome. The first stage is the alarm stage. This is the body's immediate reaction to a stressor, the fight or flight response. When something stressful happens, the sympathetic nervous system is activated, releasing hormones like adrenaline and cortisol. These cause the heart rate, blood pressure, and respiratory rate to increase, sending more oxygen to the brain and muscles. Pupils dilate, blood sugar rises, and digestion slows down, all to prepare the body to respond quickly to danger or challenge. If the stress continues, the body moves into the stage of resistance. During this phase, the body tries to adapt to the stressor. Hormone levels may remain elevated, but the body works to repair any damage and maintain homeostasis. This is when people may feel like they're handling stress, but their body is still working hard behind the scenes. Prolonged resistance can begin to wear down the immune system and energy stores. Finally, if the stress continues for too long and the body's coping mechanisms are exhausted, the person enters the stage of exhaustion. At this point, energy is depleted, the body can no longer maintain balance, and health begins to decline. Chronic stress at this stage can lead to illness, such as high blood pressure, heart disease, depression, or weakened immunity. As nurses, it's essential that we recognize the signs of stress and help our patients manage it before they reach exhaustion. This might include teaching relaxation techniques, encouraging rest, supporting good nutrition, or simply offering emotional support. The key takeaway is that the body's response to stress is natural and protective at first, but if stress continues, it can become harmful. Nursing care focuses on helping patients reduce stress and restore equilibrium. Now let's look at how stress affects people differently, because not all stress is bad. In fact, some stress can be helpful when it motivates a person to take action, solve problems, or stay alert. However, stress can also become harmful if it lasts too long or overwhelms a person's ability to cope. Whether a stressor helps or harms depends on several key factors. First, it depends on a person's perception of the stressor, how they interpret what's happening. Two people can experience the exact same event, like a new job or a medical diagnosis, but respond in completely different ways. If one person views it as a challenge, they may feel energized and focused. If another person sees it as a threat, it may trigger anxiety or even illness. Next, a person's degree of health and fitness influences how well they tolerate stress. A strong, healthy body is more resilient. People with chronic conditions, fatigue, or poor nutrition may find it harder to adapt to stress because their physical reserves are already low. Previous life experiences and personality also play a big role. Someone who has successfully managed challenges before is likely to have stronger coping skills. Personality traits like optimism, flexibility, and confidence tend to make people more resilient, while those who are anxious or perfectionistic may feel stress more intensely. Another important factor is an individual's social support system. Having friends, family, or coworkers who listen and offer help can significantly reduce the impact of stress. Social isolation, on the other hand, increases vulnerability to both emotional and physical illness. Finally, a person's personal coping mechanisms, like exercise, problem solving, or relaxation techniques, determine how effectively they handle stress. Healthy coping skills help people recover faster, while negative coping, such as smoking, overeating, or avoidance, can make things worse. As nurses, we need to assess all these factors when caring for patients under stress. Understanding how they perceive and manage stress helps us provide personalized, holistic care, supporting not just the body, but the mind and emotions as well. The key point here is stress isn't always bad. It's how we respond to it that determines whether it helps or harms our health. Coping simply means adjusting to or solving challenges. It's how people respond to life's pressures, demands, or difficult situations. Everyone experiences stress. The key is learning how to manage it in a healthy way so that it doesn't overwhelm the body or mind. There are three main types of coping responses that people use. The first type includes actions or thoughts that change the situation so that it's no longer stressful. This is often called problem-focused coping. For example, if a patient is anxious about not understanding their new diet plan, the nurse can provide clear teaching and written materials. Once the patient has the information they need, the source of stress, confusion, is reduced or eliminated. The second type involves altering thoughts to change the meaning of the situation before it triggers a stress response. This is known as cognitive coping or reframing. For instance, instead of thinking, "This illness has ruined my life," a patient might say, "This illness has taught me how to take better care of myself." The situation hasn't changed, but their perspective has, and that shift can reduce emotional distress. The third type is controlling thoughts and actions to stop a stress reaction once it has already started. This might include relaxation techniques, deep breathing, meditation, progressive muscle relaxation, or guided imagery. Nurses often teach these methods to help patients calm their body's physical stress response. It's important to remember that coping is highly individual. What works for one person may not work for another, and coping styles can change over time or with experience. As nurses, we assess how our patients manage stress and support them in finding positive, effective strategies. The big takeaway is that coping helps restore balance, physically, mentally, and emotionally. When patients learn to use healthy coping mechanisms, they improve not only their ability to handle stress, but also their overall health and quality of life. Defense mechanisms are unconscious strategies that the mind uses to protect us from feelings of anxiety, guilt, or stress. They're part of our normal psychological functioning and can actually help us adapt to difficult situations. When people experience anxiety, their body releases stress hormones like cortisol and adrenaline. Defense mechanisms help reduce that anxiety by allowing us to manage uncomfortable emotions or situations, at least temporarily. For example, someone who is overwhelmed might use humor to deflect tension or denial to avoid facing painful facts right away. These mechanisms also serve to maintain and improve our self-esteem. They protect the ego, or the sense of self, by making a stressful reality feel more manageable. For instance, a student who performs poorly on a test might rationalize it by saying, "That test wasn't fair anyway," rather than feeling ashamed. This small distortion of reality helps the person feel better in the moment. However, it's important to understand that defense mechanisms can be healthy or unhealthy, depending on how often they're used and in what context. Occasional use can be adaptive, helping someone process emotions at a manageable pace, but overuse can become maladaptive, meaning it prevents the person from dealing with problems in a healthy or realistic way. For example, denial can protect a person from immediate emotional pain, but if it continues too long, such as denying the seriousness of a medical condition, it interferes with treatment and healing. As nurses, we often recognize when patients or family members are using defense mechanisms, especially during illness or grief. It's important not to confront them harshly, but instead to provide supportive communication that gently encourages awareness and healthier coping over time. Let's finish by looking at some stress reduction techniques, practical methods that nurses can use for themselves and teach to patients. Managing stress is a key part of maintaining both physical and emotional health. The first method is progressive relaxation. This involves tensing and then slowly relaxing different muscle groups throughout the body, one area at a time, usually starting from the head and moving down to the feet. This technique helps the person recognize muscle tension and learn to release it. It's especially helpful for patients who experience anxiety or insomnia. Next is imagery, also called guided imagery. This involves using the imagination to create calming mental pictures, such as lying on a beach, walking in a garden, or floating on water. The goal is to use mental focus to quiet the body's stress response. Nurses often guide patients through imagery before procedures or during pain management. Massage is another effective stress reduction method. It helps decrease muscle tension, improve circulation, and lower blood pressure. Even gentle hand or shoulder massage can release endorphins, the body's natural feel-good chemicals, which help promote relaxation and comfort. Biofeedback uses sensors to monitor physical signs like heart rate, muscle tension, or breathing. The patient then learns to control these responses voluntarily. It's especially useful for chronic pain, tension headaches, or hypertension. Yoga combines gentle movement, controlled breathing, and mindfulness. It helps balance the body and mind, reduces stress hormones, and improves flexibility and focus. Nurses can suggest simple chair yoga or stretching for patients who have limited mobility. Meditation trains the mind to focus on the present moment, often by using breathing exercises or repeating a calming word or phrase. Regular meditation lowers heart rate and blood pressure and helps people become less reactive to stress. Finally, regular physical exercise is one of the best natural stress relievers. Activities like walking, swimming, or dancing improve cardiovascular health and trigger the release of endorphins. Even 10 minutes of daily movement can make a noticeable difference in mood and energy levels. As nurses, it's important not only to teach these strategies to our patients, but also to practice them ourselves. By managing our own stress, we protect our health, improve our focus, and provide calmer, more compassionate care to others. The main takeaway here is stress is unavoidable, but how we manage it determines our well-being. Encouraging healthy coping and relaxation strategies is a vital part of holistic nursing care. Nurses play a key role in helping individuals stay healthy, detect disease early, and recover after illness. These actions fall into three main levels of prevention: primary, secondary, and tertiary. Let's start with primary prevention. This level focuses on avoiding or delaying the onset of a disease or disorder before it ever occurs. The goal is to keep people healthy and prevent problems from developing. Examples include teaching about healthy diets, encouraging regular exercise, promoting immunizations, and helping patients quit smoking. For example, giving a flu shot or teaching hand hygiene both fall under primary prevention because they prevent infection before it starts. Next is secondary prevention. This level involves early detection and prompt treatment of diseases that are more easily managed when found early. Nurses promote secondary prevention by following screening guidelines, such as blood pressure checks, mammograms, Pap tests, or blood glucose monitoring. The goal is to identify disease in its earliest stages to prevent complications or progression. Secondary prevention can also include monitoring patients with chronic illnesses to detect worsening symptoms before they become severe. Finally, tertiary prevention focuses on rehabilitation and restoration after a disease or disorder has stabilized. At this stage, the illness already exists, but the goal is to prevent further disability and promote maximum function and quality of life. For example, cardiac rehabilitation after a heart attack, physical therapy following a stroke, or teaching a diabetic patient to care for a foot ulcer are all forms of tertiary prevention. In summary, primary equals prevention before illness. Secondary equals detection and early treatment. Tertiary equals management and rehabilitation after illness. Nurses play a vital role in all three levels. By providing education, supporting screening programs, and coordinating care after illness, we help patients maintain their health and independence across the lifespan. Answer 4. There are 3 stages of illness: a transition stage, an acceptance stage, sick rule, and a convalescent stage, recovery. Answer 2. A secondary illness, such as a stroke, results from or is caused by a primary illness, such as hypertension. An idiopathic illness is one in which there is no known cause. A terminal illness is incurable and results in death. Answer 1. Rationale: denial is a more serious form of repression. The person lives as though an unwanted piece of information or reality does not exist. Answer 4. Rationale: explaining procedures, listening carefully to the patient, answering questions, and providing privacy-reduced stress by meeting basic security needs as identified by Maslow. In addition, these measures provide respect and dignity to the patient. Answer 4. Rationale: assessment must be done without criticism, with an open mind, and with active listening. Judgmental terms such as non-compliant, uncooperative, ignorant, lazy, or unmotivated should not be used to describe another person's health or behavior.